China has insisted that investigating the origins of COVID-19 should be left to the scientists. But those scientists do not include the World Health Organization, according to its representative here.
Is the WHO doing work right now into the origins of the virus?
We know that some national investigation is happening, but at this stage we have not been invited to join. We are expecting to get in the near future a briefing on where that is and to discuss possible collaboration.
So you still haven't been invited by the Chinese authorities to take part?
Up to now we have not had the invitation, no.
I mean, that must be frustrating.
One tries not to get emotional, one tries to simply follow the process.
Is there a good reason not to include the WHO at this stage?
From our point of view, no.
And any investigation should include the 2 labs that handled viruses in Wuhan. The WHO has visited one, but not received any of its logs.
From all available evidence, WHO colleagues that in our 3-level system are convinced that the origins are in Wuhan and that it is a naturally occurring, not a manufactured virus.
Doubts have also been raised about the reliability of China's numbers. In early January, the official number of coronavirus cases stayed unchanged for nearly 2 weeks before sharply rising.
We only know what China is reporting to us. Is it likely that there were only 41 cases for that period of time? I would think not. Is that a matter of difficulty in finding were they getting their act together? Is it a question of definition? I cannot speculate, but it would have been that during that period, obviously, some growth would have been happening.
And yet for 2 weeks it simply stays the same. I mean, that seems to beg a belief.
It is unlikely that that with an epidemic of this nature, that it stays at 4 to 1 exactly.
And the key question for the whole of January was whether the virus could be transmitted human to human. As soon as the WHO arrived in Wuhan on January the 20th, they had their answer.
The healthcare worker was simply volunteered the moment we entered the fever clinic. We were shown around this, at that point, makeshift system that had been set up. And we simply asked it as one of the first questions, and we got it immediately. We got that answer. In that case, they said they had 2 healthcare workers that were infected.
Answers like that, however long in coming, were crucial for transparency. Right now, China isn't giving them, at least not to the WHO. Tom Cheshire, Sky News, Beijing.